Good afternoon, ladies and gentlemen. My name is Nirav Shah. I'm the director of the State of Maine Center for Disease Control and Prevention. I'm joining everyone this afternoon to provide an update on all things COVID-19 here in the state of Maine for today, Thursday, August 13th, 2020. Right now in the state of Maine, there are a total of 4,089 cases of COVID-19. An increase of 19 total cases since yesterday. Of those, 3,679 are laboratory confirmed, an increase of 17, and 410 are probable, an increase of 2 cases. Overall, 395 individuals have been hospitalized at some point, and currently 11 individuals are in the hospital right now. 5 of whom are in the ICU and 3 of whom are on ventilators. Overall, there have been 126 individuals who have passed away with COVID-19 and 3,592 who have recovered, an increase of 13 recoveries. Among our cases are 928 healthcare workers. A few updates on some of the outbreaks that Maine CDC is tracking and involved with. Let's start with some outbreaks that we have closed just over the last day. The outbreak at the Corsetti's restaurant has been closed after a total of 4 cases. The outbreak at Orono Commons has also been closed after a total of 10 cases. The outbreak at the Goodwill Distribution Center has likewise been closed now after 4 cases. And the outbreak at the Holton Ambulance Service was closed just a few days ago as well. Now a brief update on some current outbreaks. We'll start with some that are ongoing at agricultural establishments across the state. At Hancock Foods, there are now a total of 12 cases among workers there. At the Wyman Farm, there are a total of 5 cases, and at Merrill's, there are now a total of 13 cases. Maine CDC has continued to work very closely with our colleagues at Maine Mobile Health to conduct multiple rounds of testing. As those rounds of testing occur on a scheduled basis, Maine CDC is in turn able to have workers be designated as cleared from their period of isolation and thus be able to get back to work. That process is ongoing as we move through the multiple rounds of testing. I just want to take an extra second here to thank everyone at Maine Mobile Health for their partnership, not just with matters related to COVID, but for the full suite of healthcare services that they provide to vulnerable individuals across the state, not just infectious disease, but chronic disease and other forms of healthcare support. We would not be able to do this work without them. Next, a quick update on the Marshwood Center in Williston, where there are now a total of 41 cases of COVID-19, 26 among residents and 15 among staff. And finally, at Central Maine Medical Center, where there are a total of 15 cases in total. And finally, at Seal Rock, there are now a complete total of 5 cases among staff members that have recently been identified. As a reminder, the Seal Rock facility previously had an outbreak that was closed. This is now the 2nd outbreak at Seal Rock. Next, a brief update on some of our testing metrics. Overall, across the state, we've reached a milestone. Maine CDC has received reports now of over 200,000 PCR tests statewide among individuals in Maine. Just yesterday alone, we reached another milestone. There was an all-time high of PCR tests reported electronically to Maine CDC just yesterday, a total of 3,175 PCR tests reported to Maine CDC yesterday. Based on those tests, yesterday's one-day point positivity rate was 0.63%. We reached another milestone as a result of that, which was that our 7-day positivity rate, based on a weighted average of tests over the preceding 7 days, has also reached a new low of 0.65%. To put these numbers in perspective, the national average for positivity rates remained at approximately 8%, and Maine's 7-day average is now 0.65%. In terms of testing volume, we are testing approximately 189 individuals for every 100,000 here in Maine. With the advent of swab and send sites across the state going online, these numbers we expect to continue to increase. And finally, one more milestone I'd like to take a moment to discuss today. Today marks the 100th media briefing that Maine CDC and I have provided since starting COVID-19. I started at Maine CDC myself just about 400 days ago. So 100 briefings during that time period means that roughly a quarter of my days here in Maine have been spent with each and every one of you. But an occasion of this nature, 100 media briefings, is a good opportunity to recall the hundreds of people within Maine CDC, as well as across multiple state agencies and partners across the state of Maine, who are and continue to work 24/7 to help us collectively get a handle on all things COVID related. So much of that response continues to go unseen, even after 100 briefings. But the effect, the impact of the tireless, innumerable hours that so many individuals across the state of Maine have put in is very clearly evident in the statistics that I've shared. From the laboratory staff who show up early and leave late to run samples at our laboratory, to the epidemiologists who sort through mounds of data looking for possible outbreaks, to the investigators and contact tracers who speak with and advise folks who have turned positive, to the people who have now fielded 50,000 phone calls across the state of Maine, I'd like to take a second to thank each and every one of them for their tireless efforts over the past 8 months. They are, and we are collectively, a team that I am honored to be a part of here in Maine, and equally honored to serve the people in Maine in this capacity. At a time when science collectively should be our North Star, what's unfortunate is that it's not everywhere across the country. But what we should all feel proud about is that it's clear in Maine, scientific principles mean something. Science matters, and it matters in Maine. On a more personal note, I am truly gratified and honored for the response and support that folks all across Maine have shown to me and my family in our first 400 days as Maine people. It's truly heartwarming, and for us reinforces that moving to Maine was very much the right decision. But I think what's more important is what that heartwarming response tells you about Maine itself. Think about that. The fact that a brown guy with a funny name from a faraway state could move here 400 days ago and now be seen by at least some folks as an honest broker of scientific information says far more about the character of Maine people than it does about me. So for that, for every single person in Maine who has tuned in, who has been following the best scientific advice available and helping all of us keep a lid on COVID-19, I'd like to take a second to thank you. We are still very much in the midst of our grappling with COVID-19. And as a result, we have a long road ahead of us. And no one will know truly how long that road is until we're at the end of it and are looking back on this. But I thank everyone for their adherence to scientific principles, as well as their support for each and every one of my team here at Maine CDC. So with that, I'd like to turn things over to our colleagues in the media And today's first question goes to Alyssa Thurlow at WABI. All right, we'll come back to Alyssa in just a second. And in the meanwhile, we'll turn to Patty White at Maine Public.
Thank you, Dr. Shah. I wanted to ask you about testing capacity. You said that we're doing 189 tests per 100,000 people. Is that roughly 17,000 tests per week?
That is a little bit based on the latest numbers, Patty. We are just doing the math in my head. It's a little bit closer to about 21,000 tests per week. For the past few days, we've been reaching the 3,000 tests per day mark statewide. And so we're closer to about 20 or 21,000.
So it sounds like we're doing pretty well, especially given our positivity rate, we're doing very well. But that's still less than the projected capacity that we were hoping for this summer with the purchase of additional tests from IDEX and the mobile lab. Is there more, I guess, how much more, how come we haven't been able to meet that capacity yet? Is it because of delays with the mobile lab and getting supplies for that?
Oh, no. So Patty, I think you've confused a number of different items here. The numbers of total testing are all the tests that are being done across the state of Maine or on people from Maine. That includes tests that are being done at Quest, LabCorp, Mayo, Arup, as well as a number of hospitals across the state, as well as at Maine CDC. Part of that is as a result of the expanded capacity that we've formed in partnership with IDEX that initially have allowed us to do over close to about 1,000 tests a day just at the Maine CDC lab. So of the total testing that's done across the state right now, approximately 1/3 of it is being conducted by the Maine CDC laboratory. But as we go into the next phase of COVID-19, where testing of more individuals becomes more important than ever, we know that we've got to expand that even further. That's why the mobile lab was brought on site. The equipment in the mobile lab has been installed. The reagents have been acquired. We're in the final phases of training the staff so that as we go into the fall, as we get ready for flu season, we'll be able to expand testing even more, not just for COVID-19, but for other respiratory viruses, including most notably influenza A and influenza B. But the testing numbers that I've shared are for all tests being done, not just those specific to Maine CDC. That number, again, has been averaging about 1,000 a day.
Great, thanks so much for the clarification. And with the mobile lab coming online, I mean, do you think that will happen in time for the start of the school year?
We're hoping to have the mobile lab on time, online very soon, very, very soon.
Okay, thanks.
You bet. I'm going to turn back to Alyssa at WABI. All right, we'll come back to Alyssa while we turn to Megan at WMTW.
Thanks for taking my question, Dr. Shah. You did run through a list of outbreaks that the CDC is investigating and/or closed, but we are hearing that the Bedford Pool Community Center is closed in light of a couple of positive cases related to the Abenaki Club, a golf tournament there. Is this something that you can confirm? Is the CDC aware of it and looking into this?
Megan, we are aware of it and we are looking into it. We're aware that there was a golf tournament as well as some other outdoor activities that may have involved individuals who were positive. Right now, we have not received any confirmed cases and thus have not opened an outbreak investigation. However, our district liaison for that area has been very involved ever since we first learned about this situation. That individual, our district liaison, has been working with the leadership of that area as well as the individuals who run those facilities to provide them information, to set up conference calls and a direct line of communication with Maine CDC, as well as to provide them information about where individuals who are concerned and who might have been exposed or at the club during those times can potentially get tested, Right now, we're in the early phases of gathering more information about this. And as we learn more, we'll keep everyone posted.
Just one more question, if I could. It's unrelated, but if you're looking at numbers in total, it's roughly 2,000 students, teachers, school staff across 5 different states here in the country are in quarantine because of emerging COVID-19 cases. Is it one of those things where the CDC anticipates that as we open schools in Maine, that we will see an uptick? I'm certainly hoping that that's not the case, but is that just something that you think is a result of more people in smaller areas?
Sure. So Megan, what's just one initial point, which is quarantine does not mean that they have COVID-19. It means that they may have potentially been in contact in a school setting with someone who has COVID-19. So the 2,000 number that you mentioned are not individuals or students who have tested positive, but rather may have passed by someone in a hallway or been in the same cafeteria with someone who is tested positive for COVID-19. And as we go into the school season, that is a possibility. Now, what I think is a distinction is that many of those situations that we've seen and heard about in the news are happening and unfolding in parts of the country where the baseline number of COVID-19 cases is significantly different from what we're seeing in Maine. The reports that you've noted are from places like Georgia, Arizona, and other places where the positivity rates are still in the double digits, and the number of new cases per day in some parts of the country is what we've seen thus far since January in Maine. So those epidemiological differences do change how we think about schools. The safest way to keep children safe, the best way to keep children safe as we get ready for the school season is to keep the overall number of cases of COVID-19 as low as possible in the community as a whole. There is the possibility, of course, that there will be a child or a student who tests positive. Maine CDC has a plan in place for how we will approach those situations. But the best way to ensure children's safety as we start getting ready for the school season is to keep the overall number of cases as low as possible in the community. Each of us can play a role in that. The things that we've been talking about and have chatted about for months now, like things like social and physical distancing, wearing face coverings, don't just protect folks immediately around you, they keep community levels of the virus very low and thus pave the way for a safer reopening as we go into the fall.
Thank you.
Mm-hmm. I'm going to turn next to Isha at the BDN.
Hi, Dr. Shah. Thank you for taking my question. I was wondering if you can describe to me what the protocol is for the Maine CDC to test students, because today we learned that some students in Piscataquis County had tested positive and had come in touch with other students at some athletic activities. So first of all, can you describe to me what the CDC's advice to those students might be, or even those employees? And overall, can you talk about what this means for testing for students as they return to schools?
Sure, Isha. The essence of who should be tested for COVID-19 in situations like this, it's similar to what Megan and I were discussing, which is the basic question, the most important question is, has somebody been in close contact with someone who is now known to be a confirmed case? If that close contact has occurred, then the individual should get tested. Close contact has a pretty specific definition, which is at least 15 minutes of interaction with somebody with whom you were within 6 feet of. If those criteria are met, and so you were sitting next to somebody who was later turning out to be a positive case, or you were in any other fashion within 15 minutes of at least within 6 feet, those are the individuals, whether they be students or adults, who should be tested.
Okay, but can you elaborate on, in this situation, I've heard that not all people that came in contact with the 2 students that tested positive are going to be tested, even though they are, isolating. So is that enough in this case? or in cases like these?
Sure. So we recommend that any close contact of any case of COVID-19 undergo testing. However, there's variation even there. And so if an individual is not feeling any symptoms, some may opt to stay within quarantine and not get tested. We understand that. But the best practice is for any individual who has been in close contact with the confirmed case to undergo and get tested.
Thank you.
I'm going to turn now to Liz Graves.
Thank you, Dr. Shah. A couple of questions today. One is back on the agricultural outbreaks. I was wondering if you could share or send the information later about how many of those cases at the blueberry companies are still active. You shared, I believe, the total numbers, including the recovered cases. Is that right?
That's right. But Liz, one cautionary note: we focus here at Maine CDC on the total number of cases.
Okay.
Mm-hmm.
All right. So my next question is to the various activities we've talked about at MDI Hospital. The first is the contact tracing Sarah Alert partnership up and running?
I know that our teams have had numerous phone calls to iron out some of the IT technical details to make sure that everything that MDI Hospital needed, they had. I'd have to check, or you can check with MDI Hospital to see if they've started enrolling close contacts. I haven't touched base with them in about 2 days, or about a day. So I'm not sure where they are in that process today.
Okay, thank you. And the other question about MDI Hospital is, are the tests related to the employee Sentinel testing program? Are those samples currently being sent to the state lab, to the CDC, or somewhere else?
Their testing is for the employees in and around Bar Harbor. Those are being sent to the state laboratory, I believe. If I am incorrect about that, we'll get you the correct information. But my understanding is that those are being sent to the state lab here in Augusta.
Awesome. And the state lab has a turnaround time of about 24 hours or a little more for most PCR tests?
The state laboratory has a turnaround time of about 24 to 48 hours after samples are received at the lab.
Okay. Okay, my last question, I think you might have gotten this before, is there any chance of sharing, thank you for sharing the total cases among non-Maine residents on Tuesday. Is it possible to put those updates on the website somewhere alongside the rest of the data so folks know where to look?
Sure. So there's one important clarification. What I've shared historically, and as well as this on Tuesday, what I've been sharing is the number of cases, not the number of test results,
right?
Not the number of cases.
Okay.
A very important distinction.
Yeah.
A very, very important distinction. And in terms of putting it on the website, we can look into that.
Great. Thank you very much.
Mm-hmm. But just again, to make sure, what we've shared is the number of total test results and positive test results, which is distinct from the number of individual cases. Many individuals can be tested more than one time.
Got it. Okay.
Mm-hmm. Yep. I'm going to turn now to Jay Mishkin at WGME.
Thank you, Doctor. We got 2 questions today about schools, and they're very similar. They are similar in nature. The first one's about ventilation. We know that the recommendations for indoor settings have been to improve ventilation. We also know that many of the buildings and school buildings in our state are old. So what is one of the recommendations from the CDC to improve that airflow, especially as the weather gets colder? And the second one would be regarding Legionnaires disease. There have certainly been concerns raised about stagnant plumbing in buildings and the risks of Legionnaires and other illnesses. What guidance is the CDC giving to schools across the state to prevent possible outbreaks of those types of illnesses?
Sure. With respect to ventilation, the most important thing is to ensure adequate, robust ventilation within the classroom. That need not entail the installation of expensive or brand new HVAC equipment. It can entail just opening a window. Now, of course, as it gets colder, that could pose a problem. And so there may have to be solutions in place to install or to ramp up the amount of heating or to move students away from the windows, things of that nature. But what we've learned is that ventilation is important in reducing the potential for aerosol transmission of COVID-19. But to be sure, as we go into the colder months, balancing that need with the need to, of course, stay warm in the classroom, that could be a challenge. We'll be working to try to see what the best way, in concert with schools, how to accomplish both of those goals. But that ventilation piece is critical. And at least right now, it's something that can be easily accomplished with something as simple as opening up a window. With respect to problems that could arise related to stagnant water, that is a risk in any kind of facility that has been dormant for a while. Fortunately, it's a risk that can be mitigated by something as simple as a flushing program. A flushing program literally just entails having somebody go through the building on a periodic basis, turning on the water and making sure that there's good flow from all of the faucets, from all of the water fountains, things of that nature. There's a lot that goes into having a proper water management plan in any building. So one of the things that we are working with and working on is with owners and operators of different types of facilities across the state that may have been stagnant or dormant or vacant for the period of staying at home, to make sure that they've got everything that they need to put into place these water management and flushing protocols as folks start going back to offices and schools and other public buildings of that nature. These things can be a risk, but I think it's important to note that they can also be mitigated.
So can parents be confident in sending children back that that flushing has happened and that it's part of like a directive coming from the CDC, or is it up to each individual school system to come up with its own protocols?
The flushing plans and water management plan information is available. Now, parents should ask their schools about how the schools themselves are implementing it.
Okay.
I'm going to turn next to Amy Brown at WERU.
Thank you. New Zealand's reporting a new outbreak today, just a few days after celebrating 100 days without an outbreak. It seems to be related to workers at a frozen food warehouse. And one theory is that it may be because people came in contact with contaminated cargo that came from other places. And I know it's been a while, but you have talked about surface transmission, and it has seemed as if it wasn't as much of a concern as it initially was thought to be, and that there would be a lot more cases if it was, in fact, that big of an issue. But are there any updates on that? And is it possible that surface transmission could account for some of the cases that have unknown origin?
So, Amy, until all the scientific information are in, it's impossible to speculate as to whether something could be responsible. Based on what we know right now, and based on the latest reports from Dr. Fauci on this topic, surface-based transmission of COVID-19, while theoretically possible, does not seem to account for any of the known outbreaks that Dr. Fauci has reported on. As you noted in your question, if surface transmission were commonplace and a potent method of transmitting the virus, we would see significantly higher numbers of outbreaks, as well as significantly higher numbers of ill individuals than we actually see right now. And even if we didn't detect those ill individuals, we would certainly see it in, say, hospitalization data. So I think even though there has been scientific proof of concept that the virus can live on surfaces for a prolonged period of time, the articles that have been done on that and the studies that have been done haven't taken the next step to try to determine whether, even though the virus may be alive on a surface, whether it exists in sufficient numbers to actually generate any human cases, and whether those human cases generate outbreaks. Right now, that evidence hasn't really been procured. And so while I can't comment on the New Zealand situation until all of their investigation is complete, as you yourself observed, it is right now just a theory. And it's a theory where, if it were true, the picture of COVID-19 would look much different from the way it does right now. Is it possible? It could be. But is it a primary driver of a high number of cases or outbreaks? Based on what we know right now, it does not appear to be, but all the more reason more science is needed.
Okay, thank you. And on Tuesday, Commissioner Lambrou said that 18 swab and send sites were up and running as of Tuesday, and more were about to come online. A listener has asked how many are online now, how many more are still in the process, and whether or not the CDC will be reporting the amount of tests that are done in each location, and also possibly how many positive are coming back from each location.
We will, there are still currently 18 swab and sends that are online. A list of those can be found on Governor Mills's COVID-19 website, where under the testing section, there's a list of those swab and send sites. In terms of some of the data reporting, we're not sure if we'll put those online. We do put the zip code information online. And so I think given that any individual can use any swab and send site, there's the potential for giving a false impression that a swab and send site that's generating a lot of positive results, that there may be something going on in that area. I think the zip code data that we've got are a better view into what may be going on in your neighborhood than any data on swab and send sites.
And so how many more are in the process of coming on board, and what will be the total number when they're complete?
We're still working to see what the total number will be. We're assessing where we might need additional swab and send sites across the state to try to provide as much coverage for folks statewide. Until we've got that entire process down and we know exactly when the deals have been done with the folks that might be bringing them online, I don't want to speculate as to what the final number will be. Our process in bringing swab and send sites online, though, is to look at the map and see where there is need within certain geographies, and then where we've identified those geographies, look for partners on the ground who can bring those online. So that's the approach that we take. We don't have a number on the wall that says we have to get to X. We take a look at the map to see where there's need on a geographic basis.
Great, thank you.
And I'm going to turn to Kevin Miller next.
Great. Thank you very much. And thanks, Dr. Shah, for spending part of 100 days with all of us. It's quite a number. Following on Patty's question about the mobile lab, I know we've been told in the past that there's not a backlog of tests at the Maine CDC lab right now. As the mobile lab comes online, is there talk about expanding kind of the type of testing that's offered, like expanding universal testing to more facilities, nursing homes, or changing the standing order? Because right now, out-of-state visitor can get a test, or someone that's been in a crowd can get a test. But if you're a normal Mainer that is just doesn't meet any of those qualifications, you can't necessarily go to one of the swab and send facilities to get a test. So, is there any thought about expanding the eligibility as we get the capacity to run more tests?
Bottom line answer, Kevin, yes. Yes to all. So let me start by reaffirming that right now at the Maine CDC laboratory, there is no backlog of tests. Tests come in, they're processed and reported out within 24 to 48 hours after the sample is received here at the Maine CDC. And that has been the case for many months now. Very proud of that and the fact that we've been able to meet the demand for public health testing. But as we continue to work to expand and bring the mobile laboratory on, which will greatly expand our overall capacity at the state lab level, we are looking at what additional types of testing we would want to be undertaking. One of the ones that is top of that list, it's the one you noted, Kevin, which is nursing facility staff testing. Now, a number of facilities across Maine have already been working with either the Maine CDC or outside laboratories to undertake that testing. I don't know the exact number, but it's in the double digits that are already undertaking universal periodic testing of their staff. That's been, I think, among the many reasons why the number of new nursing home outbreaks today on a weekly basis is not what it was back in April. The number of such individuals will number, it could be 10,000+ or more per week that would undergo that testing, depending on what the periodicity is. So that's one large category that we think will serve a vital public health function in keeping residents of nursing homes safe. We're also, as you noted, looking at other expansions via changes to the standing order that could then be effectuated via the swab and send sites. We haven't made any final decisions there. Testing is important and it's critical, but it's also important to test the right folks that may have potentially been exposed conceivably to somebody. If someone has been inside for the last 7 months and hasn't interacted and has been really fastidious about avoiding all contact with somebody, it's not clear scientifically that they need to have a test. So even though we've got expanded capacity soon to be coming online, we still want to make sure that we're using it for the right scientific applications. That is to say, folks who should have a test. How that process is undertaken is one that it's not just Maine that's thinking about that, but a number of other states as well. We haven't made any final decisions on that, Kevin, but that's the principle we're using as we approach that is scientifically who should get a test now that capacity is greater.
Great. Yeah, great. And one other follow-up question on that. Sentinel testing, I know you talked about this in the past. Is that something that's being considered now, especially with the expansion of the mobile lab whenever that comes online? Yes,
it is. So maybe this is pure terminology, Kevin, and if so, then no worries. But we do consider the nursing home staff testing to be a form of Sentinel testing. There are many different flavors of Sentinel testing. But the essence of it, in my mind at least, is testing individuals who are asymptomatic, purely asymptomatic, for the purpose of detecting possible transmission nodes before they turn into a big thing. And that is what's already going on in many nursing facilities, and that which we hope to expand even greater. There's another type of Sentinel testing that's again, perhaps on a continuum, which is testing individuals not because of their workplace, in this case, a nursing facility, but literally just a slice of the population. So maybe working with physicians' offices and saying if the physician office and the patient agree to offer testing to every 50th patient who comes in the door. I just made that number up. That's another form of Sentinel testing that we're looking at. Some states have already undertaken measures like that. And the question there, Kevin, is that with the background prevalence rate in Maine as low as it is, what do we get for that? And so that's the question scientifically we've got to answer before we go down that pathway.
Great, thank you.
You bet. And the last question for the afternoon goes to Bob Evans from News Center.
Good afternoon, Dr. Shah. A viewer from West Bath asked us if you have any precautionary suggestions for parents and caregivers to follow as children begin to return home after attending school. This woman sees her grandson daily, but is getting nervous about how his attending school in person might heighten not only his risk, but hers.
That's a great question, Bob. I absolutely understand where this grandparent is coming from. As we all start resuming different types of social activity, or in this case, school-based activity, the possibility that someone in your household, or in this case, a grandchild who you see from time to time, could unknowingly carry COVID-19 with them as they come back home or come to see you is a risk. I think about that with my own family. The best precautions in this situation are the ones that I think apply to any situation. The first is that as part of going back to school, one of the things that parents will be asked with their children is to do things like daily symptom checks to make sure the child is feeling well before the child goes off to school that day. So for the grandparent in question, Bob, if his or her grandchild is not feeling well, has a fever, that may be a day not to have a visit with them until such time all testing, not just COVID, but influenza and other diseases, has come back and has come back negative. That's one piece of advice. The other, though, is that the other things that we would normally do to stay safe and healthy during this time period apply just as much, if not more, right now. So for grandparents watching right now, I know you want to see your grandkids as much as possible, but you're worried about the fact that COVID-19 may be coming along for a ride with them as they come home after school. It's a possibility. But even though that is a risk, given the number of other things that are out there, those are the ones that right now, things like pneumonia and influenza, that you can take control of. And so I would recommend using this time as an opportunity for adults out there to make sure that they are up to date and up to speed on all of their necessary preventive healthcare needs. This includes things like making sure your adult vaccinations are up to date for shingles and chickenpox and pneumonia and some of those adult onset diseases that can also be brought in by kids, as well as visiting your doctor to make sure all of your other healthcare needs are taken care of. There is a risk that COVID-19 can be transmitted from children to adults. It's not a significant risk, but it's also not based on a lot of data. As more scientific data are procured and developed as we go through the school year, we'll have a better characterization of what that risk is. In the meantime, the best things you can do are to work with kids to make sure they are safe and healthy, as well as take steps yourself to make sure that you are as healthy as possible as you go into the school year yourself. As a result, we hope that you'll be able to have all the same number of visits with your grandkids as they start going back to school as you had before COVID.
May I ask one quick follow-up, Dr.
You
Shah?
bet.
It's been reported that testing across the country has gone down. Why do you suppose the nationwide trend is lower, but Maine testing numbers are going up?
Yeah, Bob, I was just looking at some of that data myself, not very long ago. And what you see when you take a look at those data, Bob, is that it is the case. What I think is important is that although testing is changing in different parts of the country, it's going up in certain places, even though it's in some places going down in others. I can't speculate as to why that might be happening on a national level. What I can say is that I am proud that it is going up in Maine. Testing is an important strategy to make sure we've got a sense of what's going on at a population level with respect to COVID-19. Early testing helps us keep a lid on COVID-19 because cases who are positive can be identified, provided isolation support, and their close contacts can be reached out to and traced so that they too can be placed into quarantine and avoid infecting others. The real question here, Bob, is whether this trend is just a momentary blip or whether it will change as we start going into flu season. Again, impossible to speculate. What I can say is that we at the Maine CDC have been working diligently and tirelessly to expand testing capacity here in the state. As that capacity comes closer to being online, we hope to make sure that testing is more available than it ever has been in the state.
Thank you, and happy anniversary.
Yeah, thank you. I'm going to turn back to Alyssa, WABI, to see if she's with us right now. Okay, well, we'll catch up with Alyssa and reach out to her specifically. I'd like to just close again by thanking everybody for tuning in now to 100 of these such briefings. I consider it an honor to be able to share some of my day with each and every one of you and to pull back the curtain on what's going on with respect to COVID-19 and in the process talk about what public health is and what it is that we do on a daily basis. For many, many years, the work of public health has, in some circles, been something of a mystery. And even though the COVID-19 outbreak has been unbelievably challenging, it has allowed and provided an opportunity for folks like me to pull back the curtain and talk about what it is that we do every single day to keep individuals safe and how we go about thinking of things like infectious diseases. For me, the ability to do that and to share an hour of my day talking about something that I love is really, truly an honor. The fact that each and every one of you has decided to spend now almost 100 hours with me listening to how we think about these issues, again, speaks volumes about the way that Maine people think about science, how they internalize science, and how they put it to life in their day-to-day work. So on behalf of everyone here at Maine CDC, we thank each and every one of you for believing in science and following the scientific best practices. We're in a world right now where it's fashionable and commonplace to say that progress doesn't happen or that progress is impossible. I've heard that so many times over the past several years on a number of fronts. And before I sign off today, I'll leave everyone with this word. The next time someone tells you that progress doesn't happen, or that progress is out of reach, or that progress is impossible, I ask you to ask that person to take a look at the statistics in Maine with respect to COVID-19. Take a look at where we started on this journey 8 months ago and where we are now. That, to me, is the finest example of how a state of people who believe in science and are committed to making things better can achieve tangible and palpable progress. None of us alone is capable of doing that. It's only because we've all worked together as a community that we've been able to start getting a handle on all things COVID-19. We undoubtedly have a long road ahead of us, but given the accomplishments and progress that we've made to date, I'm confident that as a state, we've got the right team in place to keep going at COVID. So with that, I thank everyone. I look forward to joining everyone next week for the 101st briefing. In the meantime, as always, please be kind and take care of one another.